Okay, so we're recording. Okay, well, welcome everybody. So this is the Generations Magazine Brown Bag Lunch webinar, and it's our very first one. So very excited to have our good friend EILEEN Phillips from Attention Plus here with us for the very first presentation. We're gonna have everybody stay on mute, and we'll do questions at the end. But let's just talk generations for a little bit, just kind of as an intro here. So Generations just recently went 10 years actually as a magazine, and Percy, I think, has done a radio show and television show for a number of years. It was on hold here since January, but we're getting stuff started up again, and we're adding a webinar to this. The whole concept of the webinar is to really, it's just what our logo says there, Hawaii's Resource for Life. It's to build the resources for life for all of our islands and for everybody to just get to know who's out there, what's available, both for what you need now, but also for planning in the future. Because guess what? We're all going to age and we're all going to need help, or for ourselves or for a loved one. And so just trying to get that information out to everybody. The webinars at the end of these will be, of course, saved on our webpage, which is at generations808.com. And you just simply go to webinar. We also have a radio show that's actually started up again just a couple weeks ago, actually, yeah, 2 weeks ago. And that's also being saved. Same place, generations808.com under the radio podcast. So those are radio podcast shows. And we've already aired 2 of those. We have one more coming this Sunday. Again, it'll be on 101.1 Oldies. That's the Coral Oldies station, FM, 8 o'clock in the morning to 9 o'clock every Sunday. But the beautiful thing about both the webinars and the radio shows is those will be podcasted, so you can listen to them and watch them anytime, any place, and go back to it. It'll be all archived, so you can go back to them. Also in that generations808.com, all the magazines are there. So if you like to read online, or if you just can't find the magazine that you had and you want to find an article, you can easily go to it. Also online, we have a great resource list, and we're hoping to just continue to build that resource list. So if you see something that's missing, just let us know. We'll get it in there. And then we also have a calendar of events. So these webinars will be listed there. And anything that's coming up from other organizations around Kupuna kind of issues, we also hope to get that in there as well, so you can see what's going on around the community. So if Attention Plus has something coming up, we'll try to get that posted in there for you, okay? So that's just a little bit about Generations. The newest edition just recently came out, and you're probably aware, but maybe not. It's distributed in all the islands. They're in the Hawaii libraries, Times, pharmacy, all over the place. Also in Generations, the 808.com, if you click on that, you can also click on the distribution list and find where you can pick those up. They're free, always free, which is great. You can also subscribe, which is pretty cool. And hey, this is Christmas time, the holidays here. I've decided I'm going to get a few subscriptions for my aunties on the mainland and my mother, just so they can see what you guys are all up to as well. So kind of cool. Those will be mailed out to them. And I think that's pretty much what I have for Generations. Why don't we move to EILEEN now? So EILEEN's a good friend. We were together in the HPGS. She's been actually president of HPGS for the last year. But today she's going to talk about Attention Plus. So EILEEN attended Florida State University and graduated with a bachelor's degree in marketing in 1979. I want to hear more about that. Continued her education at the University of Hawaii to obtain a Bachelor of Science in Nursing. And then she started at Attention Plus Care in 1999, and began her focus on geriatric care in the community and home care support for families. Also, while at Attention Plus, she's worked on supported contracts with the Department of Health programs, currently under MediQuest, and integrated care programs. And then I see you've got some developmental disabilities division history. I've worked with developmental disabilities as well. And then also Veterans Affairs, which I really have a heart for. As the director of the nursing department and manager of operations, she's maintained successful audits for the Department of Health and JACO, Joint Commission Accrediting Organization. and she's just a superstar all around working with Kapuna stuff. So with that, I'm going to just let you take it. And then, oh, by the way, so at the end, we'll have questions. There is a chat box just for housekeeping. If you're new to Zoom, if you move your cursor down on the bottom, right in the center, there's a little cartoon caption box there. It says chat. Open that up and you can write your questions, and then we'll take those questions at the end of the presentation. There's definitely be time at the end for questions, so don't worry. If you list it there, it'd be great. If you come up with it later, just raise your hand, we'll call on you and you can ask the question also. All right, take it away, Eileen. Thank you for joining us.
Thank you so much, Rick, and Generations Magazine for asking me to do this. I love talking about our Kapuna and how to care for them. So being at Attention Plus for so long, it's 20 years this year, I have had so much experience and so many wonderful, satisfying situations that I've been able to enjoy working with families in the community, trying to help with their loved ones of all ages, but most of our population that we care for is in the geriatric, 80, 90, and 100 years old. So as if any of you know anybody who's 100, you know how special they are to work with. And I've certainly enjoyed doing that. I've had some of our clients for 10 years. So we've watched them grow old and older. So it's been a pleasure for me, and I love being able to share what I've learned. So we're going to talk about options for care in the home. So this is a very broad subject. There are so many options out there now. We have so many different agencies, different care homes. We have different companies that have started up to try to help with this issue in Hawaii, that we have so many elderly. We also know that people hire family, friends. They count on so much different support to help care for their loved ones. So I'm basically going to try to explain a little bit about what I have noticed as an agency, Attention Plus Care. We've experienced a lot over the years. This particular picture, if you can see it, is my home that we took this years ago as an ad that we've got all over our office, and we use it in our material. But this is my couch. That's my photo album. So I've been very involved in trying to get the company to be a success. So we're going to talk a little bit about what I call the care at home continuum. I have shown this slide before, but if you haven't seen it, I'd be happy to explain sort of why I developed this. And I did this just out of knowing what I know. Care needs change. So over time, as people go through their disease process, or they have different things that happen to them. I mean, people get cancer, they survive that. People get diagnosed with diabetes, they treat that. So there are things that change over time, and depending on what condition your loved one may end up with, or you may end up with, things can happen, but you need to understand that it will always change. It's never going to stay the same. It's not going to be stable. So first we have normal aging. And as you look at this continuum, you'll see over time that the colors get darker. As the colors get darker, what I was trying to express on this is the care needs are more intense. So here at the beginning, obviously, care needs, when someone's independent and can get up and walk around on their own, they can get their own meals, they can take care of themselves up to a certain point, their health is pretty good. It might be somebody my age who's 60, maybe 70, even through some people who are in their 80s and 90s can have no problems. But it really depends on if they get hit with a diagnosis. So something like diabetes, Parkinson's, Alzheimer's, respiratory diseases that are included in the COPD categories. These are all things that we call chronic diseases that can hit people. Hypertension, things that cause you to be either treated with medications or other kinds of treatments. So as you get this diagnosis, you learn how to improve the quality of your life dealing with your diagnosis. I mean, it's kind of what you do. You go to your medical practitioner, you get treated, you get medications, or if you don't believe in medical practitioners, you go to your holistic person and you get whatever treatment you believe will help you. So as your disease progresses, and I'm not saying everybody's going to have a disease, it's the people that get hit with this stuff that cause the loved ones to need to support them more. There are changes in your condition. So your condition may deteriorate a little bit. Maybe you have to now use a walker. Maybe you can't make your own meals because you've forgotten how to turn the stove off. These are things that we see all the time in my practice. Families come to us with, my mom's she's slowing down. She's starting to forget these things. I'm getting really worried about her. I live in New York. How can I keep track of how she's doing? I'm hearing that the neighbors are saying she's not taking a shower. So these are the things that occur and it's slow. It's not an overnight issue. The only time we get an overnight crisis is if somebody falls or somebody has a disease that is very progressive and they're coming out of the hospital. So we get a lot of those kinds of families that are in crisis. So they have a need to bring in some help because all of a sudden now they have to do all of these other things in the home for their loved one that they weren't doing before. Maybe their loved one is now incontinent. Maybe their loved one is so at risk for falling that they keep falling and ending up in the hospital. So they want somebody there to keep them safe. It could be someone that just needs to have their blood sugar monitored and they haven't figured out how to do that, or they don't do it because they're stubborn. And we get a lot of that too. So, so a change in condition could lead to needing more care, needing more intervention. Maybe it's a renal failure, which is where they need to go to dialysis. Maybe they end up in the hospital because their disease process has not been managed well, or they haven't been taking their medications. This is also something that is important if you're looking at the medical model, to make sure that if you have a disease process and you're not on the medications, you could end up, let's say you've got high blood pressure. Oh, I'm not going to take that blood pressure medication. It makes me dizzy. We get this a lot. You have a stroke. Now you're debilitated. So we've seen this happen in our families that we care for. So having that intervention of just a little bit of support from an agency that has caregivers that can help out a few hours a day goes a long way. Somebody just going in Monday through Friday while you're at work, 3-4 hours a day to make sure they take their medication, make sure they eat, make sure they take a bath. This is where we start out with our clients. As they progress in their disease process, maybe end up in the hospital. Hopefully not, but sometimes that whatever the disease is may lead to a hospitalization. We're very frequent. We get people who have simple urinary tract infections that put them in the hospital because they become septic. Then they come out of the hospital needing more care because somebody now has to watch them or take care of them when they use the bathroom, or they have to make sure they change their Depends, or maybe they have to actually wear a Depends. So these are the problems, and families get really upset when their loved ones are not able to do what they used to do anymore. So going in and reassuring them that this is okay, that this is what happens during this particular disease. A nurse having knowledge about the disease is actually helpful because they can sort of explain to the loved ones what is coming. What is it going to look like in a year? What is it going to look like in 5 years? How is this going to change my loved one? Basically, what we see a lot of coming out of the hospital, we get a lot of patients coming out of the hospital because they, all of a sudden the discharge planner says, okay, your mom's going home today. You're going to have to take care of her. She needs 24/7 observation because she's really high risk for falling right now because she's really weak. So then they go, oh my gosh, how am I going to do that? So they end up calling an agency, calling in friends, calling in family, whoever will help. Um, we get a lot of these calls because some of our families don't have other family members who are willing to help or who are available to help. So we may come in and help out, or when we talk to the families about their situation, a lot of times we'll say, well, why isn't the hospital considering sending them to a rehab facility? So this happens a lot. So when you're in the hospital and you're like in your 90s and you've had a fall and now it's time to go home and your wife is in her 90s and they say, okay, you have to go home, but you're going to need someone to watch you, because you're still weak. We tell the wife who's calling in a panic saying, why are they sending him home? It's not safe. He can't even walk very well right now. Why can't he go to a short-term rehab for a couple of weeks? Well, then the wife goes back to the husband and says, why don't we send you to rehab? Okay. And what is that? What is rehab? Oh, it's a nursing facility. So why would he choose not to go to a nursing facility? Why would he choose that rather than going home? Because they don't understand at this age, this generation associates nursing facilities with debilitation. People die in nursing facilities, right? This is what, for many years, what people considered the end of their life if they have to go to a nursing facility. Rehab is different. It's to get you back to what we call baseline, to get you back to where you were before you had your fall, or even better, to get you safer, to get you using a walker, to get you using grab bars in the shower in a shower chair, rather than trying to do it without all of that using the towel rack. I mean, it's learning. Families need to learn this stuff. So we spend a lot of time educating families even before they come on service. I've actually been on the phone with a woman and tried to talk her into going to rehab instead of coming home so that they didn't need our services yet. I'm not here to make people use us as an agency. I'm here to make sure they're doing the right thing with their health as it progresses and changes. So a lot of times we have to tell families, talk to your mom, make sure she understands that the rehab is the right way to go. It's short term. It'll be much easier for your dad to take care of her when he brings her home by himself than if she were to come home now. And people have done this. They brought them home. Then we've been involved after that. And the situation is so dire, we send them back to the hospital. So anyway, rehab is not a bad thing. It's something we cheer on for people to consider if it's the right thing for them. Let's say that at some point now you're better, now your loved one's better, maybe they're ready to go to a daycare. Or maybe they need more PT or OT in the home, which you can get Medicare to cover that if the doctor qualifies them with the correct diagnosis and orders it. Or some people continue to pay for PT and OT in the home. I know that that's what Gym Guides does, and that we've seen great results with Debbie going into the home and helping people. So that could be an option. Maybe you need more help. Maybe you need a caregiver to come in and make sure they take a shower. Maybe they need to be there for 5 or 6 hours a day, making sure the medicines are taken that are new, which are usually after people come out of the hospital, they have a whole slew of new medications. Trying to get that organized is another issue, but maybe help at home will work for a while. Maybe at some point, an assisted living facility might be good because they get a little bit of help with an assisted living facility, but there still can be independent enough to live maybe as a couple or somebody who wants to be on their own, but they get a little bit of help to make sure the medications are given. So that's always an option. But a lot of people don't want to go to an assisted living or a skilled nursing facility because of that stigma that they have in their brains. And a lot of family members have told their loved ones, I will never send you to a nursing home, Mom. You're going to stay at home and I'm going to care for you to the day you die. And they remember that. And, it's heartbreaking when they have to at some point give into that, if ever that happens. The only way that they can keep them at home is to bring in help, because doing this, if your mom is 100 and you're 80, how are you going to do this till the day they die? I mean, we've had families doing this, and they, we go in and we help, and then they bring us in more and more, and we end up giving them a break so they can get to the end of their life and have some quality of life. It's been a real interesting journey for me to observe some of these situations that people put themselves in, and I've been really, really happy to help out with some of these directions that people are trying to turn. It's a maneuvering situation for people, for families, when they have loved ones that move into older ages. So here now, let's say they get to a point where they end up back in the hospital. As you can see, I'm kind of going along this continuum. Not saying this happens to everybody, but this is just an example. Then they come home, they need more help. Maybe they bring us back in for a while till their loved one is more capable, or they get more help within their family. We always tell our clients and their families, can anybody else in the family help you? Why are you doing this by yourself? And we tell them, you're doing a great job, but you need help. I have an end of this continuum. I have a box called palliative care. And not everybody's going to actually move into this, but it is something that we try to get our families to consider when their loved one gets to a point where going back and forth to the hospital is just not what they want anymore. Having more interventions to find out what's wrong with them is just not comfortable anymore. They can still get the care that they need, the same medications, same doctors, but they have a team of people who come in and do what's called palliative care, now being also called supportive care in the community, because people don't understand what palliative means. They think it's hospice. It's not hospice. Supportive care is supporting you in the home while you go through this transition of whatever your disease process is making you go through, so that you're not having to go back and forth to the hospital, get antibiotics every week because you can't swallow and you keep aspirating. Well, you can have somebody come in, and they have nurses. So if you have supportive care, there's a nurse that can come in, and it's usually provided by hospice agencies, but they're starting to be more sensitive to that and not coming in and being a hospice agency. They're coming in and being supportive. Usually insurance companies will cover this for a period of time, short-term, 90 days, I think is one of the options. It depends on your coverage. And then if hospice does become an open window for you to move into, it's much more comfortable, because now you're working with the same people that you've been working with on the supportive care, and they can just transition you very comfortably into hospice, which is different than supportive care. Hospice is all about comfort and letting the disease process take its natural course. It's about keeping you comfortable. It's not about putting you through a colonoscopy because they think now you have colon cancer. It's not taking those choices. I tell my clients that at some point, your loved one will come and you will come as a family member making decisions. You'll come to a fork in the road, and the fork will say, I want to go this way because it means I'm going to have to get more interventions in order to stay healthy. Or you might take the other fork and say, I don't want any more interventions. I just want to be comfortable. So there comes a time when people can make their own choices about this, or if you're making a choice for your loved one, keep that in mind. Palliative or supportive care may be the first choice. It may be an easier transition. So that's my continuum of care slide. It's probably the longest I'm going to talk about any of these slides, but I think it's a good idea to understand sort of what people are faced with in the community so that they can be prepared to make those choices and have and understand those options. Okay, so I want to talk a little bit about aging in place. So aging in place is a common phrase that we've heard. And this is, for a while, this was the goal for everybody to age in place. How do we do that? Why do we want to do that? Well, the reasons we want to do that is because home is comfortable. Home is what we know. Home is where family is. Home is where it's familiar. It's also what I know. I've lived here for 50 years. Why do I need to go someplace else? There are things you have to do to age in place, and it has to do with eating right, exercising, taking care of yourself. All of those things that we already know are important. So as we get older, we certainly do want to stay where we are. We don't necessarily want to go to a facility or care home. And that can be helped by using a home health agency or somebody to come in and help with the care. So finding your team is the next slide I want to talk about. Who do we use to come in and help with this care to keep my loved one at home? Well, families, right away, they start out with family, right? Grandchildren, nieces, nephews, cousins, brothers, sisters, spouses, who can help. Sometimes they don't have anybody on island to do this, so people have to move back home. Now, what we found with some of our newer clients that we're starting out the care, the wife of, say, an elderly gentleman who's coming out of the hospital that needs more care is unable to manage all of this. She's getting overwhelmed. So the daughter from the mainland calls us and says, my mom needs help. Can you please go in and help her giving my dad a bath because she's having a hard time herself. And he's weaker and he's not taking his medicine and he won't listen to her and all these things. We get all the social stuff too. Like, he's yelling at her because she's making him take a shower, and so it'd be much easier for a stranger to come in rather than a daughter or a son, because then again, that relationship has changed. So you want to keep that relationship where it's the pride of the father wanting to have his children see him as someone who's capable, not as someone who's not capable. Now, it's not true with everybody, but we get families in this situation. So they bring maybe a friend in. They could hire friends or ask friends to help out. Neighbors, we get a lot of neighbors that actually call us and go, this is getting too hard for me. And he lives by himself and nobody's here for him. And I need you guys to go in and help him. Well, then that becomes another challenge because this is a neighbor who's making decisions for their friend who doesn't have any decision capability, but the client himself has dementia and he doesn't think he needs help. So these are just some of the example of some of the challenges that we have as an agency. And we try to work with people. We get in touch with the son who's on the mainland, who knows his dad is forgetful, but didn't realize how bad it was. So now he's agreeing to help us. So that could be a possibility. The other thing is hiring a home health agency. When you get a home health agency, you get a team of people who works with the family to coordinate the care and make sure that everything is looked at, from medications to the environment in the home, to make sure if he needs a hospital bed, that's something he can think about. Make sure that if the grab bars are needed or shower chairs are needed, that's something that can be put in place. It's all about safe, quality care when you hire a home health agency. And if the home health agency has a nurse on staff to help with medical diagnoses, progression changes, and information about medications, that can help too. The nurse supervisor also can supervise the caregiving aspect of what the caregivers in the home are actually helping him with. Your other team members are going to be people that you work with as your loved one comes home from the hospital, say like a discharge planner, a social worker, the physicians doing the discharge, the primary care physician, the rehab staff, the in-home rehab people. So there's a lot going on when somebody comes home from the hospital. For one family member, imagine a 95-year-old man coming home and his 92-year-old wife is having to organize all of this. When you have people who can help outside of the hospital situation, once they get home, they're going to be in a much better situation to manage all of the new medications that are needed. So finding your team, you want to get in good with the discharge people, the social work people, so they can direct you in the right direction. And then when you bring that person home, develop a team of people who can also help with the medical issues. So we want to ask ourselves, what kind of care is needed by my loved one now? Well, gee, it could all be different now, right? So now they've got, when they come home from the hospital, they always have to follow up with their doctor. So now they've got a doctor's appointment. How am I going to get him there? I'm 92 years old. He can't drive. He used to do all the driving. I don't do all the driving. How am I going to get him there, right? So family or social events could come up that you need to get your loved one to. Christmas is coming up. Hopefully we're not gathering right now, but when this is all over, there will be more events happening as groups of people, family members. What about shopping, grocery shopping? We ask all these questions. Who's going to do the shopping for you and your husband? If you have to stay here and take care of him, are you going to be able to go grocery shopping to get the food that you need to feed him? So those are things that people don't always think about. What about picking up medications? Can we get a mail order medication started? That's so much easier. Maybe the medications are new. Who's going to go over that? Make sure that they're taking them correctly. Maybe they are ready for other things happening in their care. Maybe they've come home now with a wound. So now the wound needs to be attended to. Who's going to teach me, the wife, how to do that? Who's going to do that for me if I can't do it? So all of these things are new and different, new equipment. Now he needs a wheelchair in the home. What kind of wheelchair do I get? Where do I get it? Can I get it ordered? Do I have to pay for it? It's hard for people in the hospital to take care of all of these little things. That's why having somebody in the home environment to help with these transitions, I call them, is going to make things much smoother. We do a lot of that. We go in, they call us maybe a couple of days because families don't get a lot of notice from hospitals before they go home. And I'm not knocking hospitals. I think that it's especially in today's environment with COVID, people are not wanting people in the hospital if they're healthy. They want them to be in a safer environment, in their own environment. So they do what they can to get them out of there as soon as possible. And we see this with a lot of the rehab facilities too. They want to get them out. So families aren't necessarily prepared. So we do a lot of work ahead of time to try to get information from the hospital so we understand the patient. I've got nurses that read the medical summaries, the history and physical, we call them, and the discharge instructions so they can explain to the family member, oh, this is what you have to do now. He needs to take this medication. It's very important because he had a stroke and now he's on a blood thinner, and that's going to keep him from getting another stroke or a heart attack. But then we have to monitor that. It's all it can be very confusing for family members if they're not medically knowledgeable. So then we look for solutions. Families have an opportunity to bring in people to help. Like, let's say Attention Plus Care comes in. I send my nurse out to the home. We understand this is where the solutions are discussed. What do you need? What are you not able to do on your own? Well, I don't have anybody that can get the supplies that he needs. He's wearing Depends. Now he needs a hospital bed. How do I know how to use this equipment? How do I, what is it that I need to know in order to give him a sponge bath in the bed? Maybe he can't get in the shower yet. He's too weak. but home PT is coming in, but they're not coming in until next week. And this is what we find. We're kind of in that space where it's like, okay, we go in when he comes home, we see the situation, we figure out what's needed. We have to talk to the family about whether they can afford this kind of care, because this is private pay. A lot of this is private pay, unless they have insurance, which is the MedQuest integrated care process, which they can qualify for depending on their income. And that will only allow a certain number of hours per week for care, in-home care. And then there's also the VA programs and the disability programs, which do help, but they don't cover a lot of time, or they don't have a lot of funds federally or state locally to cover the cost of this care. So families are having to pick up the cost of some of this care. So then we focus in on what do you really need and how long and when during the day do you need it? Is it when he gets up in the morning and is really active, or is it in the evening when he starts to get his sundowning or his behavior gets worse? Or we have to make sure he takes his medication in the evening and gets his meals. So we go through that whole process with the person who's making the decisions about the care, which could be the client, or it could be the wife, or it could be the son on the mainland. And then we decide on a schedule. So as we learn more about the client's care and his disease process, we also do some work with the family member who makes the decision to help them decide whether they should move into a different kind of care, like supportive care. Or, I mean, we've had families that have made the decision to put their 89-year-old dad through a surgery that really wasn't necessary. But it's their decision. So we do educate. We do a lot of educating in that regard. Is, if it were my dad, what would I do, kind of thing. And that's finding the solution. Maybe not having the surgery is the right thing. And we've had clients who have decided not to, but they have symptoms, but it's okay. We get them through it. So how do you know when you need more help? So there's always a time when, as a primary care provider for your loved one, that you're feeling at the point you can't do this. You don't know enough. You need to, you feel alone. You feel like at this point, I'm not getting enough help from my siblings. They're inundated with their own issues. I'm having to do this all on my own. And the care just might be too complicated. We've seen family members learn how to do IVs through a PICC line. I mean, this is what they're sending people home with. G-tube feedings through a gastric tube. They've been doing that for years. Trach care, suctioning trachs as a family member. There's even dialysis, peritoneal dialysis is being done in the home now by family members. So there's a lot of changes that are happening in the community, not just in Hawaii, but all over the country, with some of the in-home discoveries that, they can send people home with these things that they need to have done. I wrote an article in August in the Generations. I don't know if you saw it. It's about needing more care at home, and how do you manage that? What can you do about that? So that's when having a nursing agency, a home health agency versus a home care agency. So I'll talk a little bit about that. The state of Hawaii has made a new law requiring anybody who's doing care in the home as a company needs to have a license. So a couple of years ago, all of these home health and home care agencies applied for licenses with the state, and they were just about everybody was granted a license. About 100 companies are now doing care in the home, but some of them are home care agencies and some of them are home health agencies. So home care agencies are not allowed to do assessments like take a blood pressure. They're only allowed to do the care that is needed for making a meal, making sure they take their medications, but not looking at the medications to see what they are. And they can do some of the personal care, but if it has anything to do with like taking a temperature, can't do that. Home health agencies can if they're licensed to do that. Attention Plus is both licensed as a home care agency and a home health agency. So we do have different levels of care, which a lot of agencies have. Some agencies can do only up to the home care level, but other agencies are able to do home health care, which involves helping them with G-tube feedings, taking their blood pressure, assessing their skin, looking at doing wound care. Most of those agencies should have a medical professional on staff so that they can look at the diagnoses and understand what's happening with the pathophysiology of the disease. So anyway, I got off track, but anyway, how do you know when you need more help? It's when you know that you're being asked to do things either by the doctor, the hospital, the discharge planners, and you feel like it's too much. Bring somebody in who can help you. Asking the right questions for care in the home. Okay, so let's say that you've decided to hire a home health agency or home care agency. The first question you should ask them is, are they licensed by the state? How do I know they are doing what they're supposed to do based on the state regulatory agency? Now, right now, the Office of Healthcare Assurance is a little overwhelmed with all of the things that they're monitoring in the state in regards to healthcare. So are they checking up on home health agencies to make sure that they're doing the care in the home and being licensed? I don't think so, not right now, but eventually that will become an issue for those that are doing care in the home and are not licensed. So how do I find out if the agency is licensed? I meant to have the website on my presentation, but I don't think I got it in there. But it's called the Office of Healthcare Assurance. They will have a link to the list of agencies that are licensed. And that'll show whether they're licensed as a home health agency or a home care agency or both. Is your agency that you're asking for help, do they have someone who can supervise their employees? This is the hardest thing that we've heard from families that have come to us initially, but they thought, well, maybe this other agency is cheaper, so I'm going to go with them. Even though we've sort of educated them on what it takes to get through this care that you need for your dad. You're going to need to have someone who's knowledgeable on this, this, and this. And then they hire this other agency because they just don't have the money to invest in a higher rate, maybe. So they don't have supervisory people who watch the caregivers, and no one is checking to see if someone is actually showing up. So a lot of these families come back to us and they go, you know what, that other agency didn't quite pan out because they didn't tell me that nobody was coming yesterday. So we just had to do the care ourselves. When you have an agency that has supervisory people who watch what's going on, like I watch the whole operations of this company. I make sure that the scheduling department is monitoring all the schedules of all of our clients. I make sure that all of my nursing supervisors are checking in with their families and their clients and their caregivers who are on those cases to make sure that they're doing the proper care and nothing has changed. And in this business, things change every day with every client. So it's a big job and you need to have people who supervise what's happening in the home. Do they have a 24/7 call center, which is also a requirement that the Joint Commission has as a home health agency. And I believe the state licensure quality assurance department also requires us to have a 24/7 call center, which means if we're doing care in the middle of the night and something happens and our caregiver is in there, who do they call? Or who does the family call if something's going on with their client on Christmas Day or on a Saturday or a Sunday? Does the agency have someone they can call to say, I need more help, or cancel the schedule because I'm taking them to the hospital? So we have a 24/7 call center that has a scheduler and a nurse available to manage all of those urgent issues that come up with when you're doing care in the home. And then also you got to ask, do you screen your employees? How do you do that when you hire people? Do you do an FBI fingerprint check? Do you do a background check? Do you do drug screening? How do I know these are not people that are just off the street? And right now, it's very interesting because of COVID. We have been hit with so many people coming in because they don't have a job. And these are people who've worked in restaurants, who work in the tourist industry, hotels, hospitality. They've been out of work for so long. They've decided to move into a position that actually is going to stay in place because of what we do. We're in essential workers. That's why I've been coming to work every day ever since this thing started. So we have to do those background checks. We have to get a history of where these people have worked, what they've done. We have to do the drug screening. We do all of that before we hire anybody. And so does this agency you're asking for help do those kinds of things? And one of the things I wanted to point out when you're looking for help, if you can't afford this kind of care, this is actually a license that we have. It's just an example of what a home health agency license looks like. You can ask for that. You can ask to see it, and who signed it. And it's something that is important. And here's the 24/7 call center. So, okay, now here's something that I wanted to talk about. Can my housekeeper take care of my dad while she's there? I have a housekeeper who's there and she does the cleaning, but she also checks on my dad because he's doesn't remember to eat all the time. So sometimes they hire their housekeeper to do the care. So, or somebody privately who's coming in that they know already. It gets to a point where that housekeeper can only do so much unless they have a medical background. So that's okay as long as your loved one is stable enough for someone who just needs supervision, right? And what about medication for your loved one? Who's going to explain to you what the new medication is and how it's supposed to be taken? Can it be taken with food? Should it be taken before you eat food? Should it be taken? Should it be monitored with blood work? These are the kinds of things that families don't have the answers to, and they're not really educated that well. When new medications are started, they may be told, they may be said, here's the information, just read it. But who's got time to do that when you're bringing your loved one home from the hospital with 8 new medications? So having somebody to come in and help you decipher what those things say is important to maintain the health and safety of your loved one. So there's other things that we always talk about is, now that you're debilitated, who's going to make sure you have food in your home? What are your options? Can you have a grocery delivery service deliver your food? Do you have to go out and do it? Do you want a caregiver who can go do this for you? These are all things that we have to think about. And maybe a food delivery is an option. They're out there, especially now we've got food pickup because of COVID, right? There's a lot of Kapuna programs. We've learned about that when we had the webinar at HPGS. The city and county is really working on their programs to get food to the homes of our Kapuna. And these might be an option, but maybe the families aren't aware of them. So the other thing that we like to offer as a home health agency is to have a nurse go into the home and do care, what we call care management. Families have hired us to just do that. They don't need a caregiver, but they need someone to go in and check on their mom once a week. Just look at, is she taking her medicine? Is she, she's maybe independent enough to get her own food, but she just, maybe she doesn't know the medication well enough to really take it appropriately. So we go in, we pre-pour it for a couple of weeks. We go back, see if she's taken it, see if she's having side effects, see if she's taken a shower. These are all things that a nurse can pick up on. So those are all important things to consider, and they're all different levels of care. Having a nurse go in versus having a housekeeper go in is very different. So I call this a team approach. So as a agency who has staff who's able and available, you can provide medication reminders. You can help prepare healthy meals and snacks, not just cookies and cakes, which they may get at Zippy's. You get a lot of that too. Not knocking Zippy's. It's just, this is where a lot of our elderly people go and pick up meals sometimes. Assist with exercise, physical therapy exercises that maybe were put in place at the rehab center that they were at a month ago. Well, they usually stop doing them. They don't do it when they have the opportunity to not do it. So having somebody go in and assist or encourage, stimulate brain activities with conversation. If your mom is alone, just having somebody there to talk to or to share information, even if she's got dementia, is helpful. And we know this because we've seen it. We've seen the changes that have happened when our loved ones who are elderly now are isolated because of COVID, and how much they've changed because of that. Accompany on walks or other outings, like maybe Christmas shopping, if that's something that they're willing to do. Caregivers can alert a nurse if they're working for a home health agency that has a nurse, if something is starting to look funny. So a lot of times because we have a nurse on call 24/7, our caregivers are trained and educated on some of the things they have to keep an eye out for. And one of the things that we get calls on a lot because of the population we serve is a change in behavior. So if you've worked with anybody in the geriatric field, you know that a change in behavior indicates there's something wrong. What is it? Why are they having a change of behavior? And it wasn't just, it wasn't a gradual change like dementia can do. It was an overnight change. Like all of a sudden now they're yelling at the caregiver, or they're refusing care, or they won't eat, or something, or they're hallucinating. So caregivers are alerted to these kinds of symptoms that indicate an infection. So our elderly generation doesn't necessarily have an immune system that works like our healthy adults. They may not get a fever. They may not show pain. Their symptoms are, the first sign of an infection is a change in behavior. So having a nurse and calling a nurse and saying, you know what, Mrs. is not herself today. So then the nurse calls the family or the doctor and says, hey, there's something going on with your mom or your patient that we think she might have a problem. Can we intervene now before it gets worse and have her evaluated to possibly need some antibiotics? So we've done a lot of saving of emergency room visits. We've even saved lives by going in and catching people who are having massive strokes because they are looking different. It's really important to have someone who can reach out to a medical professional immediately and get that assessment evaluated. Attending doctor's appointments, our caregivers can sometimes go with clients to their doctor's appointments, or we can send a nurse if that's more appropriate and the family would rather have a nurse go. The caregiver in the home can communicate to the family if the loved one is, like I said, getting better, same, or getting worse. So it's tracking that change that I talked about in the continuum of care. What's happening? Is the Parkinson's advancing to the point where now we have to change how she eats and what she eats? Does she need to have thickener in her fluid so she doesn't choke? Does the food need to be pureed because she's not swallowing well anymore? So those are the changes that happen gradually, and that's because of a disease process. I think that is pretty much what I've got right now. I'm going to check and see if there's another slide, but I think that's the last slide. So this is how to reach me. Attention Plus Care is our address is we're over on Makaloa Street. We have an office here. We've been in this particular place, I think, for at least 10 years. That's our main number and our website. We also have a Facebook page. The picture on the screen is of the owner of the company. Her name is Carol Samples, and she is the one that started this company back in 1983. She is a nurse. She has experience in home care, which was her first job in Hawaii that she did as a nurse. And then, of course, this is when we made our 30th year. Mayor Caldwell did a proclamation for us. So we're really proud of the fact that we've been around for a long time. Time has flown by for me. I can't believe I've been doing this for 20 years. And like I said, I've enjoyed every minute of it. And thank you so much for having me on this webinar. And I'm ready to take any questions that people may have put in the chat, if possible.
Okay. Do you want to close your screen and then we'll have a full gallery of
Sure.
us? And we've got about 7 questions here. So I don't know if folks want to answer their own, ask their own questions, but let me start with the first 3 and then I'll call on you. So what are some of the important questions to ask when you're looking for care in the home from for an agency? So what should people be asking?
Okay, so I talked a little bit about that, but I can answer a little bit more because I didn't go over all of the questions. But one of the things, besides having a medical professional on staff with the agency, is helpful. Asking them about how they screen their employees is important. Asking about how they supervise their employees is important, because you just don't want to have, there are staffing agencies out there that just find people for you and then you're on your own. Yeah. They pay them, but they don't necessarily supervise or monitor anything that's going on in the home. You want to ask if they're licensed. Do they have their agency license? Asking about accreditation is also an extra question, because not every agency in the state is required to be accredited. There are different accrediting agencies out there. The Joint Commission is the oldest and the biggest accreditation. I know that it takes a lot to be accredited by the Joint Commission. Our agency chooses to do that because it makes us get to a higher standard of care. And that's the owner. The owner has decided to make sure we're Joint Commission accredited. The other questions I would ask is, do you have a 24/7 access to your on-call staff for changes or emergencies? Do you have backup staff in case your caregiver is sick? What are you going to do about that? Do you send another caregiver? Can you make sure that I get covered with my care? What kind of training program do you do with your caregivers? Do you train them at all? We've had some caregivers that have moved in from other companies that say, I never got this kind of training. I'm really grateful to get this. So it's those kinds of questions will help you decide whether or not that's the right agency.
Does Attention Plus require that they have a CNA to do the care? Does it matter for companion care, or how do you guys approach that?
So the state put in a regulation years ago that did not require home health care to have CNAs. And they have stuck with that. However, the CNA recertification for people who have their CNA can now be recertified by a home health agency if that home health agency is licensed and has all of those things in place that I talked about. Right. So the good news is not all of our caregivers need to have their CNA. If we do have caregivers that have a CNA, we can recertify them based on the fact that we have nurses supervising their care.
Right. Right.
So the answer is no, they don't have to have their CNA, but we do have caregivers with their CNA. Okay. Which we like, which is great.
So if somebody were to find a caregiver on Craigslist for their parent, What would you recommend they do?
I would recommend they
Cynthia says
either,
no.
so this is where some of the nightmare scenarios happen, not always, but people on Craigslist are looking for a way to get into homes for whatever reason. Some of them are legitimate. Maybe they want to make more money than what an agency can pay them. But my advice is to not go with that person unless you're willing to do a background check, a drug screen, and monitor them. Yeah,
Need to get fingerprinted annually, every
get
year.
all the get everything that you can possibly find out about this person.
Yeah.
And then watch them.
Yeah.
And make sure that there's a camera in the home, which a lot of people are doing, which I am all for, by the way.
Right.
I would choose to go with someone who knows what they're doing for sure.
Yeah, you kind of said it, but you really do tend to get what you pay for. So I know folks are hurting financially, but you got to be careful and make sure they have just what EILEEN's program has to cover folks. Next question. If I need help with more advanced care, can I ask the home giver you said this a little bit already, to do it without making sure she's trained? Probably not, yeah?
No, so we have what we call a skills qualification set that when the nurse goes into the home and identifies the skills that are needed for the care that may be more advanced, like maybe things like bowel routines or G-tube feedings. We have to go back and look at our employee staff, and if we're using people who are not trained in that, they can't go.
Right.
So we match the caregiver's skills with the client's needs in skills, so that if they're not trained, then we train them. We have a training program for advanced skills, which we love doing that because then we have more caregivers available for those kinds of for that kind of care.
Right. Yeah. So a caregiver working for Attention Plus is going to have a lot of opportunity to advance their skills through training that folks offer, and you guys are qualified to do that.
Yes.
So that's great.
Yeah, we have a whole training skill lab in the back with a mannequin and all kinds of equipment. So, yeah.
So say a caregiver comes out to work with your loved one, and your loved one and you don't like them. What do they do?
So they talk to their nurse supervisor, and they talk to their scheduling person, which everybody who comes in with us as a client gets their own scheduler and gets their own nurse.
Oh, okay.
So what the communication has to be open, right, about how the services are going. So if they don't like, for whatever reason, they don't like somebody with curly hair, right? It's like, I can't do that or whatever. Or their personality doesn't gel with their family member and they're getting agitated. They can ask for a different caregiver.
Okay.
So we will try to find out, what is it about this particular caregiver that is causing you to not like them? And then we'll try to avoid that. Now, sometimes we can't, because of either a skill that's needed. They might be the only one that has that skill. They may have to work with us on this until we can get somebody else trained to do that kind of care. So it's a cooperative effort. It has to be open communication with the family.
Yeah. Okay. I know in my previous life, we occasionally had times that people were basically letting everybody go. What do you do in that situation when they don't like anybody?
So we educate the family. So we say, okay, here's what we have. We have put 10 caregivers in your home and you don't like any of them. Yeah. We try to educate and say, look, is there anything, we have tried everything we could possibly do. What do you want to do? Can you, we get new people all the time, but again, it's an effort of the company to try to satisfy the needs or just the desires for the perfect caregiver. So we start off and say, because a lot of people come to us and go, I only want one caregiver Monday through Friday. I don't want to have all these people coming in my house. So then the education starts. Okay. So if you put all your eggs in one caregiver and they're the only one that knows your dad's care, how complicated it may be, or how particular it may be, and that caregiver calls off sick or goes on vacation or, heaven forbid, leaves the company, we have to start all over again. So
Right.
I always tell my families, it's not our first choice to put one person on a client and count on them to know the care. The other reason we don't do that is because the relationship between the client and the caregiver gets so close over years, it could deteriorate. And all of a sudden that caregiver could become like a family member, and
Yeah.
it gets a little bit,
Yeah, the roles get kind of
yeah, the
shifted.
rules get fuzzy. And so I always advise at least 2 caregivers on every client's schedule, if we
Good
can do
idea.
that.
If there's a new caregiver coming out that's never been there before, does somebody introduce them, help them get to know the?
So it depends on the level of care. So
Yeah.
if it's a complicated advanced level care, yes, we have this team of people called mentors. So our mentors go in with people who are new to that case. If the instructions are, thorough, which we like it when they're thorough,
Yeah.
or if it's a complicated client care, then they go in and they work side by side with them the first shift. We don't charge for that.
Okay.
We do charge for 1 caregiver to go, but we don't charge for 2. So we do a lot of that with a lot of the new people coming in, that it may be their first time with the company going out and working. They're automatically partnered with a mentor to go on their first couple of shifts until they're comfortable. Because besides the clients getting used to the caregivers have to get used to the clients.
Oh,
And they
yeah.
have to learn about what the care looks like and what it should look like. So yeah, we
Yep.
have that program in place. And sometimes the nurse supervisor will go out if the caregiver needs to have specific advanced
Yeah.
care, like G-tube feeding kind of things that we have to
Right.
delegate.
Because part of
Yeah.
the routine becomes just the person and the personality and how they do things as well. So that's very important.
Yeah,
Everybody's
and people are particular,
Yeah. Oh,
they're
absolutely.
paying good money for us to be in there. They want it to be done right. So,
Well, and it's sensitive stuff that we're doing. So that's important. And I'm just going to throw in, so Percy says that this is one of the best overall presentations on caregiving and planning that he's seen, and we want to get you on the radio show, so make a note.
Thank you, Percy.
And then when this is, let's see, so next question is from, Debbie, do you want to ask your question or you want me to ask it on palliative care? Go
Yeah,
ahead.
it's just with palliative care, it's a relatively new area, and I've heard people kind of describe it in different ways. So I just wanted, maybe if you could give some examples of like ideal situations where palliative care is really appropriate, or maybe something that we want to recommend.
Okay, so the one that people don't always think about for palliative care is when your wife of 65 years now has advanced dementia, and the care for her is becoming overwhelming for the husband, who wants more than nothing but to care for her properly. And so what this does is, because she's got dementia, she's maybe not taking her medicine, she's not eating, she's not taking showers, so she gets sick often. But it can be treated. But if she would just do these things that the husband's trying to get her to do, she'd be okay. But because she has dementia, she won't do it. So palliative care or supportive care can come in and just be another support for that husband he himself is having health issues because of the care he's having to do for his wife. And just having that other team of people coming in to support him and make sure the medications, if they have to be adjusted, if she's got a UTI because her dementia, her behavior changed all of a sudden, they can prescribe that rather than her going to the doctor. Going to the doctor with somebody who has dementia is not necessarily the easiest thing to do. So that would be a really unusual palliative thought. People don't think about that for palliative care. They usually think that, they have to have some disease that is physically debilitating them, but that's not necessarily true.
So is the eligibility typically that someone has a chronic or debilitating disease?
Yeah.
And that it's really to try to minimize the extent to which they have to go to an institution or an office to get care?
Right. That's exactly right. And there are limited insurance coverages that cover HMSA right now is the only one that covers palliative care, unfortunately. So if they don't have HMSA as their Medicare choice, they won't be eligible for supportive or palliative care. Some of the obviously, like a cancer diagnosis, it's early in the cancer stages, but we're not, we're still getting chemo, or maybe we're getting some radiation, but we're not wanting all of the other interventions, not wanting to go back to the hospital for every little complication. Supportive care can help with that. There are other diagnoses, I think, congestive heart failure, maybe one.
How about COPD?
Yes, I think that is one, yes. I'd have to check with my hospice contacts to find out exactly, because we did have some we referred to palliative care, but they didn't qualify for some reason. It's different than hospice. Hospice has more qualifying diagnoses than supportive care. So, but dementia, advanced dementia is actually one of those.
Okay.
Does that answer your question?
Yeah, and I was just thinking of someone who just is so debilitated that they're basically bedbound. Family members take care of them at home, but
it's going to depend on their diagnosis. That's really what it is, unfortunately, and it's going to depend on their insurance. It'll change. We have learned so much about the care that people are getting in the home, and insurance companies need to open up to the changes that are coming. So I'm hoping that things will change.
There was a hearing last year that they did at the state capitol on palliative care, and talked about just what you just said, that it's going to change. It just needs to keep happening. Percy, you have a question here. Hospice care is different than HMSA? Is that what the question is?
No, it's the palliative or supportive care option or benefit is only covered under an HMSA plan.
Oh, okay.
So like if you have another type of insurance, if you have Kaiser, if you have, as your Medicare option, it doesn't cover supportive care right now. I think that the other insurance companies will have that as an option. It's just better. It makes more sense to go have supportive care during this time because it keeps them out of the hospital, right? Because that's more expensive. So if once insurance companies figure that out, then they'll keep it as a benefit.
Because they'll save money.
Yeah.
Yeah. Well, don't get palliative care confused. Palliative care for hospice care confused with what you're talking about.
No.
Totally different. With palliative care on the hospice side is more about pain management. But you're right, HMSA, I wish more insurance companies, they used to have the Nurses Without Walls where they would come in a few hours a week, back in the day. That's why I mentioned my earlier one with MedQuest, they would do that. And they are trying to get more in-home care services because it's just going to be needed. There's not enough people, not enough facilities, not enough beds anyway to have them in a facility, let alone, we lose so much money on Medicaid for long-term care in the first place,
Right. So on that, Cynthia asks, does Attention Plus, do you guys offer hospice care or?
So we're not a hospice organization. We don't, we're not qualified to be a hospice organization under the Joint Commission or we don't have a license for that. But we do work alongside hospice organizations as the team providing the care for the personal care and hygiene for the person who's dying.
Yeah.
We work real closely with the hospice nurses and coordinate our care plans so that they're the same. We update them when there's changes, but we're not a hospice organization, but we love working with them because that's part of our scope.
Yeah, it's good to collaborate with them. That was actually Sherry's question. Can long-term care insurance cover services also?
Yes, absolutely. But the agency needs to be licensed. Usually it depends on the policy. There's also, and there are many different policies out there. So let's say you have a Genworth long-term care plan. And it says in its in its benefit that you have to wait 180 days before their services or their reimbursements will kick in.
Right.
Well, you can start, you can start care with us and put in a claim. And then once that 180 days has passed, then because we're already in there as a licensed home health agency, they'll start reimbursing the family. Definitely have to be a licensed agency to do that though.
Yeah, you guys are in good position because you're doing home health and home care, which is something in long-term health you want to watch for. And the other thing is that some have limits on how many hours, how much you can spend.
Correct. So then the family ends up paying outside of that. So like you could have a $250 limit a day, and but you're having services that cost $325 a day.
Right.
So you have to, so we work with the insurance companies too to make sure they get our invoices, our charges, so that they know exactly what the dates, because they're starting to require that from agencies now.
Oh, yeah.
They want a record of care. They want to see what the notes say, whether the person actually needed help that day. They want to know what the rates are. And but we've been doing
Makes
that for a
sense.
long time.
Yep. Okay. I don't know who asked this question, but types of services. I feel like you kind of covered some of this, but somebody wanted to know more specifics about types of services that Attention Plus offers. Do we feel
actually, that's a good question. I didn't really go into detail about the different levels of care. We have care that starts with just what we call a health companion, where they just go in and they supervise the person, help with meals, light housekeeping, medication reminders, and just socialization. But they don't really need any hands-on care per se. Like they don't need help in the bath. They can take their own bath, but they need someone to kind of remind them to go into the shower and kind of stand by to make sure they're safe in the shower.
Or just transfer,
or they can stand up on their own. So this is actually I hate to say the lowest level. It's the minimal care needed is the health companion. The next level is our basic home health aid level, which is where most of our hours are in that level, because that's what most people need, is help getting into the shower, help needing bathing, to help them reach those areas they can't reach themselves. Maybe helping them in the toileting area, helping them also with the light housekeeping, the meal prep, and the medication reminder. So everything that the higher level of care does, that the lower level of care does, the next level does. So it's sort of a cumulative level. Then we have an advanced home health aid level, which is where they do more advanced care. Like I talked about, the G-tube feedings, the bowel routines, maybe checking blood sugars, anything that needs a nurse oversight. We even have an advanced level that includes challenging behavior. If it's a difficult client behavior because of dementia or Alzheimer's or whatever, brain injury, that kind of thing. The next level after that is nursing. So we do a lot of nursing care in the homes for people who are medically fragile. This involves the skilled nursing part of like trach care, people who are on ventilators. That's got to be a nurse. So we do that as well, because we have a number of medically fragile people that are qualified for hours that the state has in the MedQuest area, which is the old nursing home without walls, is what Percy was talking about. They should be in a nursing home, but they're getting nursing care at home.
Right.
That's our highest level of care.
Okay. Any other questions, anybody? I've gone through the list that I have. Debbie says, great presentation. She logged off, so we lost a couple folks there. So again, just really appreciate it. That was excellent, EILEEN. Really enjoyed it. Good,
it was really my
information.
pleasure.
Yeah, thank you for leading the way for us here.
I'm sure you'll have some wonderful presentations coming up.
I'm excited. We have some good folks that partner that we're going to draw in, and so I want to remind you, Percy, I'm not able to pull up the promo, but I want to remind folks that the radio show airs every Sunday from 8 o'clock to 9 o'clock on 101.1 Oldies FM Coral. It's also a podcast, so pretty easy to access this webinar once we post it. So probably tomorrow it'll be posted, I hope. Just go to generations808.com And then there's sections for webinars, there's sections for the radio podcast, the articles, all that kind of stuff. You can also, like EILEEN said, she does have an article on this generation that just came out. So, and frequently has articles in there. So do look for them. They're very informative. So do a great job. So really appreciate it, EILEEN. And thank you everybody for joining us. This is a soft rollout. We'll have a bigger audience going forward. All right, I'm going to stop the recording.
All right, thank you.